Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the lens-induced glaucoma, first we have phacomorphic glaucoma. Okay, in phacomorphic glaucoma, there is an intumescent or swollen lens is present. This intumescent and swollen lens will block the meshwork, resulting in the glaucoma. That is, this is the pars plicata, this is pars plana. These are the ciliary zonules. This is the lens. Now here the lens is swollen. Okay, this swollen lens will actually cause dislocation like this. They will the swollen lens will close the pupil. Once it closes the pupil, the fluid cannot pass from the posterior chamber into the anterior chamber, thus resulting in glaucoma called as phacomorphic glaucoma. This occurs due to the swollen lens.
thank you and thank you for watching.